Welcome back to the Humble Healer podcast. And this is Dr. Quang Lei. And thanks for joining me and tuning in for this episode. Today, we will continue with the mindfulness series and how it can improve your health. And in this episode, part two of the mindfulness series, we'll talk about how you can use mindfulness to face fear, anxiety, and panic attacks. Every day, I see at least a few patients or healthcare staff that works with me, struggling with anxiety, panic reactions, as well as fear, most of the time manifesting in physical symptoms such as chest pain, insomnia, shortness of breath, bowel irregularities, headaches, and all kind of pain and many other symptoms. Most struggles with chronic anxiety, dealing with all the adverse effects of the dominating fight or flight system. And please refer to the previous episode where I talk about the fight or flight versus the rest and digest system, and how one system, if left dominated, will ruin our health, happiness, longevity, and resilience, while the other promotes all those things or factors while helping suppressing fear, anxiety, and panic reaction all at the same time. I also discussed in previous episode about the practice of Stoicism as a form of self-cognitive behavioral therapy to help promote our health and happiness and deal with whatever stress that life may throw at us. In this episode, I will go over the mindfulness practice that we can use to help prevent anxiety and fear reaction, as well as how to stop these uncomfortable sensations and feelings on their tracks with simple techniques that anyone can learn to do at any time. I have helped patients use these techniques in clinical settings to help fight anxiety, panic, and fear reactions, as well as help my kids dealing with these sensations when they arose. The bottom line is that the more often you manage to stay in the rest and digest mode, the less likely you will experience these reactions. And if you let the fight or flight mode take over, then these reactions can come at any time, which can paralyze and incapacitate and make you fearful that these will happen again in the future, creating a pretty bad vicious cycle. And also refer to previous episode about things you can do daily to help keep you in the rest and digest mode. One simple thing to do is managing and mindful of your breath, and you can do this anywhere, any time. Let's start with how mindfulness can help anxiety, and this involves focusing on the present moment, just like for fear and panic reaction, as you see later, and focus on the present moment without judgment, training your mind to observe anxious thoughts and feelings rather than getting carried away by them, using techniques like mindful breathing, body scans, and we'll talk more about that, or mindful activities like eating or walking to calm the nervous system, reduce stress, and build emotional resilience, often proving as good as medication for most people, or if not better, as I've seen people with panic reaction applying these techniques, and we'll talk more about that later. And these techniques help faster than taking a medication to relieve the anxiety and panic reaction. So some key techniques for anxiety include body scans, which systematically bring awareness to different parts of your body, noticing sensation without judgment, and also engage present moment focus. Engage fully in simple and everyday activities like eating or walking by using all your senses to experience them rather than dwelling on the past or future worries. Stay at the moment, doing the dishes, washing the table. Just stay right there. And guess what? They will not become as boring or as a nuisance to you when you actually focus doing that particular activity at that particular moment. Try that next time. Even taking a shower can be a better experience when you do that mindfully. Observing thought, acknowledge anxious thought as just thoughts. Let them pass like clouds without attaching to them or believing them as absolute truth. Returning to your breath. Remember one of the messages I recommended for you, for your subconscious, every morning. You are not your thoughts. You are an observer of your thoughts. Thoughts are just thoughts. They don't dictate, they don't define who you are. If you say, I'm so scared, I can't do this, say, yes, I can. Yes, I can. I can do this. I've done this before many times, and I will do this again. It's something that you can debate among yourself and encourage yourself. And those panicking thoughts, they will pass. They will pass. One mindfulness author described one time he suddenly felt anxious before a public speaking event about his book. So he started focusing on his own sensation, He took deep breaths and focused on the dry mouth that he was having, the tight and tense shoulders and neck, and relax them as he took deep breathing, and also butterflies in his stomach. And also, before he realized it, the panic reaction was gone. So you focus on yourself, become a bystander or an observer of your sensation, both physical sensation and mental sensations as an observer. And you focus on that particular moment and not worry about anything that will happen in the future. That they will pass. They will pass. How it helps anxiety because it reduces stress response. It lowers stress hormones and calms the fight or flight response. That's the enemy there. That's the acknowledge that it's there to save your life when somebody chases you down a dark alley, but not in this particular moment. It only makes you incapacitate you. Improves emotional regulation, teaches you to respond consciously rather than react automatically to anxious feelings. Create distance. It helps you see anxious thoughts as temporary mental event, not reality, creating space for calm. But you do need to acknowledge these feelings. Do not block, do not avoid them. Acknowledge and take a deep breath and acknowledge the sensation, the feeling. That's the key. Build resilience. It cultivates inner calm and the ability to cope with difficult emotions. Get started. How you start with just a few minutes daily and gradually increasing practice time. Even when you're calm, use this as a practice. Since when anxiety hits you or panic reaction later, as we mentioned, you want to be able to do this without even thinking twice, without significant amount of practice. You already have it in your system. You just have to use it, and it'll become a lot easier for you to go through the body scans and whatever technique you use for deep breathing exercise in the past, and that will help you. And also focusing on sensation. You can do that anytime. It's very easy to do. What are you sensation? What are you feeling right now? What are your body is telling you right now? Just acknowledge that and breathe through it. Use guided meditation if you're new to it. But the key is to be patient and compassionate with yourself. It's normal for the mind to wander. Accept it. Everyone minds wander. That's part of our DNA. Just gently bring it back. Just treat it like a cloud that's passing by and let it go by and go back to the center. It's okay. For severe anxiety, mindfulness can be a powerful tool alongside professional treatment, medication, and use that and consult a healthcare provider for personalized guidance in terms of how you can incorporate that into your overall treatment to help with your daily anxiety or panic attack and so on. So do that every day. Stay on the rest and digest mode. Practice every day. And when anxiety hits you, you are ready. You can acknowledge your sensation and you breathe through it. Now, for panic attacks, it's different. In anxiety, we deal with daily grind catching up on us by way of the fight or flight pathway. But in panic attacks, it can hit you like a ton of bricks, incapacitating and paralyzing you, making you feel like the world is about to collapse around you. It's a terrible feeling. I've seen it many, many times, and I don't wish that on anyone. And it makes you feel like you're dying. Mindfulness helps with panic attack by grounding you in the present moment, observing feelings without judgment, and calming the nervous system through focused breathing and sensory awareness, creating distance from overwhelming fear and panic reaction. Key techniques include slow, deep breathing, again, body scans, and engaging your senses in this time, in this particular instance. And seeing, hearing, touching, repeating affirmation, and visualizing a safe space to anchor yourself and reduce intensity. One of the important keys is to anchor yourself. Like you're sitting on a chair, you know where you're sitting, you're right here, right now, in this present moment. The key is focus on breathing. Take slow, deep breath. Inhaling through the nose, exhaling slowly to activate the relaxation response. Just keep doing that. 1, 2, and you can do the 7-4-8 technique for this. Inhale, count to 7, hold for 4, and then exhale, count to 8. Again, 7-4-8, 7-4-8. Keep doing that. You can count it. And then next you can go on to your body scan. Notice physical sensation. What are you feeling? Notice your tense shoulders, tense neck and upper body, tense lower body, tingling sensation without any judgment, and moving your awareness from head to toe if you need to. So use that body scan, very important, and then use it to also focus on where you are tense the most and just breathe through it. The grounding technique 5, 4, 3, 2, 1 I've used successfully with few patients and even family members to help name 5 things you can see, 4 things you can feel, 3 things you can touch, and 4 things you can touch, and 3 sounds you can hear, 2 things you can smell, and 1 thing you can taste to anchor your surroundings, keep you there at that moment, right there and anchored, so you're not wandering anywhere else. I've seen that helping patients. When I get to the sound that you hear, the panic reaction is gone. It does work really well. It works better than medications. So again, the grounding 5, 4, 3, 2, 1 sensory techniques. Use that and practice that. Because sometimes when you're in panic reaction, you do not remember what sense and how many things, 5 things you can see, and so on. So keep practicing every day, and before you know it, you'll be very proficient with doing that when you're in a full panic mode. Sensory engagement, again, focus on one sense, like noticing colors or sound in your environment to break the panic cycle. You can focus on one sense if you like, as long as you stay focused on that. Present moment. Visualization, imagine a peaceful, safe place to create calm. Going to the beach at the moment where you see the calm ocean. Remember one time you sit by the ocean and you just hear the sound of the ocean. Stay right there and take a deep breath. Stay that day. The beauty of your mind is that even though it's wonder, it's allow you to want to go anywhere you want, anywhere that you've been in the past, or and so on, and find the most calming scenery and breathe with that, and it'll help carry you through this panic attack. Affirmation, repeat calming phrases like I am safe, this will pass. Again, I'm not my thoughts, I'm only the observer of my thoughts. So don't let your thought dictate who you are or dictate how you should be. I am safe, this will pass. So how mindfulness help with panic reaction? It helps by way of let the panic event pass through and do not let you be consumed in that panic reaction. So it reduces the overwhelming reaction. It teaches you to accept feelings rather than fight them, reducing their intensity. Acknowledge them, acknowledge your sensation, and say this will pass. Activate relaxation, deep breathing in present moment, focus lower heart rate and blood pressure, according to research. Now, how to prevent a panic attack? Just like anxiety reaction, keep yourself in the rest and digest mode. Will keep the panic and anxiety and fearful reaction far and far away. Create a regular practice with consistent meditation and mindfulness. Build resilience to anxiety and stress. Create a safe space. Designate a comfortable area in your home for calm practice. And learn. Practice this method when calm so they are available when needed, as we mentioned above. Mindfulness for fear involve, this is the last part, is dealing how to deal with fear and how to use mindfulness to help your fear. And it's involved acknowledging scary feeling without judgment, anchoring yourself in the present with your breath and body sensations, and creating distance from fearful thoughts to see them as temporary mental events and not reality. Using the same technique again, like deep breathing, body scan, curious observation to build calm and reduce fear's power. Instead of fighting fear, you learn to sit with it, understand its physical sensations, and gently redirect your attention to develop resilience. Step 1 is anchor with breath and body. Again, with deep breathing, slow, controlled breath, calm the nervous system, start your body scan, grounding again on neutral sensation like your feet on the floor or feeling up your hands. Observe fear as a passing experience. Again, just like panic reactions, say that fear is here or I feel fear to create space for the emotion and watch it. See fear as a wave. It rises, it peaks and falls. Notice the thoughts and stories it brings without getting swept away. Same idea is not being consumed in this fear reaction or panic reaction. Observe it gently, acknowledge it, and say that this will pass. I do feel the fear, but it will pass. Shift from I'm fear to I feel fear, mean that allow you to take charge of the emotion. This subtle language change create distance, allow you to detach from the feeling that related to the whatever that's causing the fear, moving from identification to observation. Very important. Remember, switching from I am fear. Remember that your thought is dictating who you are to I feel fear. I notice you. I notice the fear, but I'm breathing through it and this will pass. Lean in and be kind. Don't avoid it. Intentionally sit with the uncomfortable feeling to learn is manageable. Do not avoid it. Acknowledge. Just like panic and anxiety reaction. And then don't forget to treat yourself with compassion, kindly for feeling afraid, perhaps with a wishful phrase like, "It's okay, I'm here with you. It's okay that I'm not okay right now. It's okay that I feel the fear." Learn to accept and show yourself some kindness and compassion for feeling that way. Say that it's okay. Visualization. Imagine fear behind a door, allowing you to observe it without being trapped. Try to see that. Allow you to confront it a little bit more, but without feeling that trapping sensation. By training your brain, mindfulness contains neural response, teaching you to be less fearful, do a less fearful reaction, and breaking anxiety habits. Remember that you cannot control what life gives you, but you can control how you respond. This is how you respond. You use your mindfulness to help you respond so that you don't get incapacitated and paralyzed. You don't fight it. You don't block it. You don't block any sensation. You let them come. You acknowledge, you feel them, and then you breathe through them using body scans, using the grounding techniques, and so on. Reduce control by seeing fear as temporary sensation or panic reaction or anxiety reaction, but not a part of you. Can reduce its power. That's the goal, and that's the key to the successful management of your fear, anxiety, of panic reactions. When you have these reactions, but practice daily. It only takes a minute or two if you do practice the grounding technique or body scans or whatever tense part that you're feeling, acknowledge and try to breathe through and relax them. It may even help with your chronic pain, fibromyalgia, anxiety. Do this technique 3-5 minutes every day to become proficient so that when the time comes with this panic reaction or fear, you can learn how to breathe through them. And that'll be better than any medicine that I can give you. Good luck, and I hope you find this mindfulness practice and techniques helpful. And let me know if you have any comment, and please share with anyone that you know that's struggling with these reactions. Thank you, and take care, and thank you for tuning in.